Inner core strength and the importance of protecting our lower back and hip area. Today, I wanted to talk about the importance of trying to activate these muscles when it comes to different transitional movements and how it can offload and offset other muscles from being overactive. Hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. And today I want to talk a little bit about the importance of inner core strength, pelvic floor strength, and working on stabilizing the pelvis when it comes to different transitional movements. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So as I mentioned, the pelvic floor muscle, which essentially is a deep abdominal muscle that surrounds the pelvis and helps to stabilize that area, is really important when it comes to doing different transitional movements. So this might be getting out of bed, sit to stand, lifting, going up and down stairs. So what can happen is if this muscle is weak for whatever reason, then the body will naturally compensate for this and overuse other muscles that can result in pain and discomfort for a patient. So that might look like overuse of some of the muscles in through the lower back. This might look like muscles in through the front of the hip area, which can cause, as I mentioned, discomfort and pain for patients. And so just as a general rule, right, when we come to, again, transitional movements or specific movements in the lower extremity, it's going to be really important to try to activate this muscle, to try to strengthen it, and basically incorporate it as part of the exercise routine. And so essentially when we're doing this, what we're trying to engage here is bringing that belly button in towards the spine and kind of hollowing the stomach as a way to try to engage this muscle. And then as these muscles are being used when it comes to these different transitional movements, the hope then is it becomes somewhat automatic as a general stabilizer for patients when it comes to, again, movements such as sit to stand, getting out of bed, all of these different transitional movements or lifting in order to stabilize the pelvis, and so that we don't overuse or have this sort of guarding taking place in these muscles that can cause patients discomfort and pain. If you're an individual who might be struggling in terms of back or hip pain and is really looking to enhance your overall function from the comfort of your home, feel free to reach out. My website information is below. And please check with a physiotherapist to make sure that this or any other information is appropriate for you. Thanks again for watching and have a great day. Take care.